treatment used in the medical field. Medicine. For almost nearly any kind of ailment, medical professionals will prescribe medicine. Pharmacists are the most well-versed in this practice. As a member of the EAP program in ETSU's own pharmacy school, I would like to indulge you about a specific type of medicine connoisseur, the infectious disease pharmacist. Why learn about these special fields in pharmacy? Well, to broaden your viewpoint of a typical CVS type pharmacist, these specialties help even doctors crack the codes of some of the most unsolved medical cases. To start understanding their importance, today I will discuss what these pharmacists know by their scope of practice, perform in their everyday careers, and research when given the chance to do so. For starters, understanding what an infectious disease pharmacist knows is crucial to how important they are in the medical field. Scope of practice is a legal term used to describe care limitations medical professionals can provide. On August 31st, 2019, an article, Pharmacist Care Process by Dr. Weaver and Adams, commented that typical state laws allow pharmacists to order or interpret lab tests, participate in collaborative practices, and prescribe or regulate medication. Infectious disease pharmacists, ID pharmacists for short, follow these same guidelines, yet they apply them to fit patients who suffer from infections. Specifically, ID pharmacists will contribute to the, quote, prevention, assessment, treatment, and monitoring of patients with the infection, says an examination done by the Board of Pharmacy Specialties in 2023. These pharmacists are experts in providing antibiotics, which are specific to bacterial infections. They also face viral or fungal diseases. Even though it may sound disgusting, fighting these diseases is crucial to our understanding of a smaller world. Bacteria is actually good for our immune systems. The deadly pathogens ID pharmacists face are the root of their profession. I will talk about bacteria later in the research section ahead. Now you know the basis of ID pharmacist practice, I will tell you how they perform that said practice. Depending on a pharmacist's location, like a hospital, inpatient clinic, or outpatient clinic, they can have slightly different procedures. Today I will focus on the typical clinical roles these pharmacists perform. On March 13, 2013, Dr. Quantel posted on a forum on studentdoctors.net, where he explains that ID pharmacists participate in rounding. Rounding involves going around to each patient's charts, ensuring that the information is correct, and speaking on a team of professionals about the patient's overall healthcare plan. ID pharmacists take a special look at patients' medical charts to make sure that their medications are effective and helpful. They can also be responsible for diagnostics, says Dr. Quantel, which is interpreting data or lab tests. By now you should feel comfortable about ID pharmacists' practice and performance. I will finally tell you how their research is vital for the future of healthcare. Not only are they great at providing care, but they are actively involved in research programs that fight for global health. For instance, I will explain antibiotic resistance and how the ID pharmacists dedicate their whole lives to exploring the answers to this problem. On November 16, 2021, the Society of Infectious Disease Pharmacists website posted a video titled "The Pharmacist's Role in Combating Antibiotic Resistance," about the importance of antibiotic research in their careers. AR is the action of bad bacteria becoming resistant to antibiotics, which, remember, is the #1 common medicine prescribed by infectious disease pharmacists. This growing issue is never ending because bacteria will forever evolve to survive their antibiotics. This is why scientists such as ID pharmacists are such an important member in the medical community. They can dedicate their careers to understanding bacteria and the antibiotics used to treat them. Hopefully you now have a general understanding when you hear the phrase ID pharmacist. The thoughts that should spring in your head are about the scope of practice, including prescribing, administering, and regulating medication, clinical roles such as rounding and lab tests, and their abilities to provide research that can change the future of healthcare. Infectious disease pharmacists are only one of these many specialized fields in the world of pharmacy. Take a chance to look into some of these unrecognized fields. Maybe then you'll understand that their impact is not on just our lives, but the lives of generations ahead.